Welcome back to my YouTube channel, guys. Dr. Anjana here, and I am super privileged to have Dr. Karolia with me today. Dr. Karolia, how many years have we known each other?
It's so long I can't remember, but it's been a while.
It's been a while.
Yeah, it's been a while, but it's probably from the beginning of the time we've been training here as well.
So like 13 years seems like a long time.
Yes,
so, Dr. Karolia, tell me more about, because I know you are, so experienced. You have a wealth of knowledge in aspects of anti-aging as well as aesthetic medicine, and you make sure you come to the congresses. You're always learning. Tell me a little bit about your practice. What do you do?
Thank you, Anjana.
Yeah.
I appreciate this very much, and all the accolades I got from you, especially coming from you, it is very means a lot. Anyway, I'm Dr. Ashraf Karolia, as I'm known by most of my colleagues, by Dr. Ashraf, and my main interests is integrative medicine, where we focus on hormonal balancing, bioidentical hormones, anxiety, depression, neurotransmitter balancing. And I think I'm the first beneficiary of that because I suffer from PTSD after an accident, and this helped me so much. And I didn't pee out expensive urine, but I think really it's superb. After 21 days of treatment, I noticed everything abating, getting better. My anxiety, my depression, all of that got better. And I said, integrative medicine is the medicine of the future, and it will help us for insulin resistance, especially for my diabetic patients. We are run a specialist diabetic clinic, and for that, I think the key is lifestyle. The fact that it's insulin resistance, the insulin levels are very high. So we're tending to treat with insulin, and I don't think we're getting it right because weight just get more and more weight gain. The other thing I do is aesthetics, so I do a lot of things. And as Anjana knows,
you're not a jack of all trades. You know what you're doing in all that you do. So I hate that saying jack of all trades. I think it's nonsense. I think it's really nice that you diversify, because you have to look at the person in a holistic way, and it's not just surface value like aesthetics.
Yes.
So I think you're doing it the right way. And you mentioned insulin resistance. It's more and more common today, especially young children, growing, and then a lot of patients, and I see a lot of like Indian women, especially.
Yes.
PCOS is a very big thing, very common. So it's nice that you address that, but you have to. I'm sure you're seeing children as well. You see some kids, like young teens.
I see women coming in daily, and with experience, you could eventually just treat them with hormone balancing. You already know they have PCOS. The blood results and the test results that we do, or the genetic testing that we do, it's just to confirm what we already know.
Yes. So you mentioned genetic testing. So when you say integrative medicine, is that different from personalized medicine, or do you think it's the same thing?
Oh, okay. Once you start doing integrative medicine, it is personalized.
Okay.
And you cannot be seeing a patient like an ordinary general practitioner does for 5 minutes. It's impossible.
Yes.
You're going to see us for at least a half an hour to an hour consultation to get the real benefit and true benefit, so that we get to know you and you get to know us. And I think you will really, really benefit from this. And I've taken this method and this approach for a number of years, and it's very, very hard for me to just practice in general practice.
Okay. All right.
So it's always a long consultation. But Anjana, I would like to thank you.
No, thank you.
Express my gratitude to all of you for having me here.
No, thank you so much, and thank you for telling us what you do. So, if you guys have any questions, anything about aesthetics, integrative medicine, lowering your insulin, pop them in the comments down below. Like, share, and subscribe. Bye.
Thank you very much. Thank you.
Thanks.
Thank you.